Hi, greetings everyone. Welcome to my Lupus living room. I am Suzanne Turney, the CEO and lupus patient, or your fellow Lupian here at the Lupus Foundation of America's Greater Ohio chapter. I'm real excited to have a special guest with me today, and a lot of you may not like this conversation, but I think it's a conversation that needs to be heard. Okay, so I love this gentleman already because his name is Bill. All right, so Bill, welcome to my Lupus living room here at the Lupus Foundation. Go ahead, give your 2-second commercial on who you are and what you do and why you love to do it.
Okay. Yes, I am. Hi, Suzanne. Thanks for having me here. I am Bill Fikter. I'm a psychiatrist, and I am the Associate Medical Director at the Willoughby office of Signature Health, which is a federally qualified health clinic which treats primary care and behavioral health disorders in Cuyahoga, Lake, and Ashtabula counties.
Wow, that's a very long statement, but wow, I'm real excited to talk to you because I think mental health is very important. I think it's a conversation that needs to be had that's not had enough. I personally, in my lupus journey, and I know everybody's lupus journey is a little bit different, okay? But, and I don't know what you know or don't know about lupus, but truly it is a complicated illness, one that's very difficult to diagnose. It could take a very long time. The patient could be doctor hopping in a search to find answers, or perhaps not like the answers. And the reality is, it's not a quick diagnosis. And for the physician that's on the fence and waits to does that diagnosis, I love him because he's going to take some really good time to evaluate what's going on. And of course, there isn't a specific diagnostic test. So there's a variance of things that they use to make a diagnosis, and certainly you should be in front of a physician who understands lupus. But my argument with many of these physicians that I have often is as part of the criteria or the protocol to take care of the patient, why isn't mental health part of it? Usually they want you to see a cardiologist or a nephrologist or a dermatologist, but they don't talk about a psychologist or a psychiatrist, okay? And doing this journey on my own, I recognized that I couldn't do it by myself. But it wasn't until I hit rock bottom, all right? And so the conversation needs to be had because the physicians that I spoke to said that they get so much resistance from the patient about the conversation. And like myself, because it took so long, it took 19 years to get my diagnosis. Different time in life now, it is quicker. It could be 3 years, it could be 6 years, but 19 years was an incredibly long time being misdiagnosed. So I felt like a hypochondriac, okay? And I was on a mission to find a resolve, so I just kept doctor hopping, which is not, don't do that. It's not a good idea, okay? For multiple reasons, another conversation though. But they said too often the patients feel, one, by the time they get to them, they feel like a hypochondriac, okay? Two is you don't believe them or they think you don't believe them, and there comes a combative conversation or mistrust. So they're reluctant to do that. I mean, they will as they get to know the patient, but on the onset, they do not. So why do I think that's important? You've been diagnosed with the chronic disease. This disease is going to follow you all your life. There's going to be changes. There's going to be different types of impacts. You're going to feel loss. You're going to feel lonely. And the emotional gambit that comes at you is incredible. And I remember all that. And it's like, it wasn't until I was forced, and this is no secret, I've shared this with my colleagues and other friends and even my bosses here, is that it wasn't until I hit rock bottom and I was forced to see a mental health professional. Suicide was on my mind constantly. And that's another conversation for another time as well. But I want people to understand the goods or the value of seeking a mental health professional. And here in Ohio, I think we have so many more resources than other people. So you heard what my concerns are. I want patients not to be afraid to seek for help, or when do they seek help? So that's the conversation. Hopefully, you have some valuable information to share with my concerns for my fellow Lupians.
Sure.
Mm-hmm.
Yeah, there's a lot to unpack there, and the I think the word that I started hearing in my mind as you were talking is stigma. I think a lot of people with have certain thoughts about what mental health is, what mental health treatment is, and there's a pretty strong resistance to me not being that. I can't have a mental health thing. I've got you know uh, I'm physically ill, but not
Mm-hmm.
not having mental health issues per se. And I think also as part of the journey of getting diagnosed, a lot of people probably get feedback from doctors that are working with them that, oh, this is just anxiety or depression, and frequently with autoimmune and connective tissue disorders, that's the answer from a lot of doctors is the labs aren't really saying anything. There's not really any smoking gun to explain what's going on, especially in a chronic condition like this. And so I think patients might be sensitized. People might be uh, kind of may have heard in other areas about it being more of a mental health than a physical thing. And when they get a diagnosis of lupus, then finally there's a physical thing to account for it, and therefore the mental health is no longer kind of consideration, or they don't think, or they would prefer it not to be mental health. I guess is kind of that stigma at play. But the thing is, you can have both. You can definitely have depression and a physical illness. In fact, any chronic physical illness is going to overlap with depression a lot. It's going to create a lot of symptoms that look and act like depression. And a chronic illness will deplete your resilience. It'll make you more tired, run down, and anything that does that will make you more likely to get into a clinical depression.
Right. So I suffer from depression. Matter of fact, I had a Zoom call with my doctor the other day because for me, a day without Prozac is a day without sunshine. Okay. And we upped it. All right. Because I got this blue mood going on. Okay. And it is fatigue, it's confusion, it's frustration. It's like another person's living in the house with me. And it's like, oh, wow, how did I get here? But I come to the fact to know that it can be treated. Okay, it can be helped. And yes, when they first mentioned a, a drug like Prozac, and I'm not saying you're going to take Prozac because God knows there's a multitude of different types of medications that are out there depending on your issues, but um, I thought Prozac was for a crazy person. Okay, so I was like, I'm not taking that. I'm not crazy. People are going to think I'm crazy, And what I realized, if I didn't take it, I became a crazy person. All right. So, and again, through the years, and I've been on antidepressant medications for decades now. Okay, and I can tell you, it's really about choice. All right, and and either you're going to take it or you're not going to take it. So you're either going to feel better or you're not going to feel better. So it's not a hard choice, all right? And the stigma is real. The stigma is absolutely, and I miss saying that, and thank you for bringing that up. It is real. So how do we overcome stigmas? Okay, and how do we make a choice um, to seek out mental health? Because here in the state of Ohio, we got a fabulous governor who is really behind mental health, and there are dollars that are poured into the budget on various fronts to help with mental health. So, how do we get rid of the stigma? How do we get people to understand it's okay? And here's what I'm going to tell you. My people can hear me say a lot of time it's okay, it's not okay. I learned that from my therapist. After years of visits, at the end of the day, it's about a personal choice. It's either going to be okay or it's not going to be okay. Or the glass is going to be half full or it's not going to be half full, but the choice is up to you. So how do we get people to know? How do we get to that point? I hit rock bottom, okay? So I don't want anybody to hit rock bottom. Do they just need to have more conversations?
I think that's a big part of it. I think that it's talking about it. I think it's putting it out there for people to be aware of. I think it's acknowledging that depression is a physical illness. It's related to brain chemistry. It's related to body functioning. It's related to social circumstances, and it's not just having depression or any mental illness doesn't make you weak or less than or inferior. It's the way it's where some people's brain chemistry has gone with the path that they've been on. And the other important thing is that it's treatable. Between counseling and medications, we can achieve remission with depression. Remission is basically when the symptoms, it's as if the symptoms had never been there, when you're completely back to your normal self. That's our definition, and that's our goal, and it's absolutely achievable. I guess the other thing, too, kind of put the cart in front of the horse a little bit. Um, Depression does kind of sneak in. So everybody has days where their energy level isn't quite as good. Everybody has days where they're a little sad and frustrated about this or that. But when it gets to be more and more, and when it becomes the default, when it becomes how you're functioning is miserable and negative and depressed and everything, you know, it doesn't matter if the glass is half empty or half full. It just when you're that down and that's your state of mind, that's a clinical depression, and that is something that can be treated.
Yeah. It's interesting because I went 3 years through therapy, okay, and a lot of it was pain management as well, not with medications, just with how to live with constant pain. And to this day, and it's funny because I don't even know if my family is aware of this, but because what is talked about in therapy is it's a safe place. Okay, there is a pitcher on my bedstand for water. Okay, so if it's half in a glass, so if the glass is half empty or half full, I can always fill it up. It's a reminder to me that I can fill this up. It's a pretty little pitcher with the glass. Okay, so we did a lot of guided imagery, a lot of biofeedback, various techniques, EMDR, all this other stuff. And after a while, I became intrigued with it. But I will tell you, being sick every day, it's really hard. It's really hard for those of us so lupus has its flares and remissions. So when you're flaring, and the other problem is I don't look sick. So I'm sitting here and you're looking at this girl, she's pretty bubbly. Man, you can't see how miserable my insides are. Okay, or what it took to get me here this morning. And I was late, by the way. Um, but it's a family effort. Bill has to push me out of that bed. He's got to say, you got to get going. You got to do it. And I know if I get up, I'll feel better. But getting out of the bed is very difficult. Okay, because my lupus is connective tissue, all soft tissues are all inflamed. I do have central nervous system involvement, so I have this tingling, burning, like what is it, pornopathy all over the place, across my face and my hands. So but it's getting there. So being sick every day, you think about, am I going to get up? Why am I so miserable? So the day-to-day pain and the fatigue that comes with lupus is depressing in itself. All right, and the other thing is I have cognitive dysfunction. So let's I'm on a rabbit trail now, okay? But the cognitive dysfunction, is that hand in hand with depression? Because it's all from the brain. So what happens to the brain when we get depressed? Is it chemical? Is it? I always feel like the brain is just flattening out. I feel like I'm getting a flat head. Okay.
Everything gets slowed down. Everything becomes a chore. Everything becomes difficult. Cognitive dysfunction can be part of it too, and that feeds into isolation and the lack of motivation and wanting to get out and do things can all exacerbate or cause or exacerbate depression. And in your case, and I'm sure for a lot of people, it's practically part of the lupus. It comes with it, and so there's a real setup to get into a clinical depression because you already have some of the symptoms of depression to start with, and then brain functioning is also affected by the immune activity that's happening in the rest of the body. So those inflammatory chemicals that cause pain and inflammation in muscles and other connective tissues also have a negative impact on the brain and can cause depression or even other psychiatric symptoms as well.
So, something has just come to light. So, for my fellow Lupians that are out there here in the state of Ohio, um, and I don't know, maybe there's a broader reach as well. The Cleveland Clinic here um, is doing a study. They have an open study going on for my fellow Lupians for cognitive dysfunction. All right. So it's being charged by, spearheaded by Dr. Littlejohn. She's a lupologist at the Cleveland Clinic. So if that's something you're interested in participating in, I would highly suggest that you contact the rheumatology department, or you can circle back to the chapter and we'll give you the link to the study. I think we have a link to that study. Is it on our website or where do we have it at? We have to call. Okay.
Is it just an assessment study? Is it a diagnostic study, or is there a treatment component?
I don't think there's a treatment component. I think it's just a study at this stage. Okay. But she's a phenomenal doctor, Cleveland Clinic, right here. If you're local, let's be a part of change and see what they're trying to find out, because I know a lot of us do have it. So, do you know the difference between a support group and psychotherapy?
I think so.
You think, well, I'm just, because people go to a support group and expect psychotherapy.
Oh, right.
Okay,
Right.
so what would you say to, I mean,
Well, support groups to me are really necessary for public education. They're very necessary for family education and awareness of knowing that other people are in the same boat, have the same situation. But but psychotherapy is very different. Psychotherapy is someone who is trained to really work with you on your symptoms and help improve your symptoms. I'm a social person. I've gotten a lot of support from peers and friends over the years, and I've gotten some wonderful advice from those peers and friends, and I've gotten some terrible advice from those peers and friends, even though a lot of my friends are working in mental health. But a psychotherapist, per se, has a different perspective. They don't have their own agenda. They are really your agent, your coach, the one who's working with you to help your symptoms get better. So each one is important for its own reasons, but yeah, they're definitely not the same thing.
So this chapter, we are part of a national network, okay? And there's very few actually chapters in the United States, okay? I couldn't be prouder of this chapter. But this chapter is the only one that is led by people who actually have the disease. So I have it, two of my staff members have it, and we feel very strongly about support groups and offering resources to the best we can. So we do cover the entire state of Ohio, and I don't know where you're all listening from. You could be from various different states, but know that there's a huge network. Even though there's not chapters, there's regional offices of the National Lupus Foundation of America. But if you're in the state of Ohio, we have a large inventory of support groups, whether they're in person or if they're online or if it's a phone call, or even if you need support here at the office, our other patients will talk to you. And we actually have a nurse here as well that will talk to you. Or if you can catch me, I will talk to you. So we're not in a support group. I just want to be clear for as an educational purpose here, is support groups, he's correct. It's not meant to give you mental um, directive as to how you should treat your mental health, okay? But what it is it is a safe place for you to come and speak and share with other fellow Lupians and your families and their families to kind of take the edge off of the fear and the isolation and loneliness or the misunderstoodness. And I think it's been phenomenal. Before COVID, I think I had the largest support group. I don't know, it was huge. Okay, and we became an extension of each other's families.
Mm-hmm.
Okay, we created a community. Now we still all don't get together in person as much because a lot of our Lupians still haven't come out from COVID. Okay, a lot of them were not vaccinated. A lot of them are afraid to come out. Or actually, some of them may become lazy and need a push to get out of the chair to come out. All right. Um, but the value that I saw in it, and I've listened to thousands of people's stories. I think the stories are priceless. The stories they share. Some of them have good content in them. Some of them is misinformed content. So what I enjoyed when I facilitated a group is as they gave their 2-minute commercial, what I called it, um, is how incredible it was, like a 50-50 split. 50 of them actually had solid, good conversations to share. The other 50% were so misinformed. So it gave me directions to know what type of education was needed or how to set them straight. Okay? So it's about support group is about sharing and caring. It's about education, and you come together. You can learn from some stories, or you know what, better yet, maybe you can help the guy sitting next to you who's got it wrong. Or maybe you can help the guy next to you that has no support system at all, and you become a buddy, a lupus buddy.
Yeah,
Okay.
and that's incredibly important. The studies. I was a little surprised researching for this talk that the one factor which has the most impact on developing depression in lupus is social support. Whether relationships are strained or if a person has people that they're able to talk to, and that is a stronger impact than the medications. As a physician, I thought that prednisone would have a lot to do with generating depression because it certainly can. I thought that
That's right. It's CRS. I'm not even going to tell you what that means.
There's another factor that I thought would have a lot to do with it, but it actually turned out being more social support or lack of social support.
So it's interesting, and Alex and I spent 4 hours in a car ride yesterday together. Okay, what's interesting, Alex is my wingman.
How'd that work out?
Okay, well, he's very chatty. Okay, and for those who that don't know Alex, he is our digital asset manager, and through COVID, he's got us through being able to still communicate with our constituents via like podcasts, webinars, anything tele, anything digital, the website, emails. And he has a level of frustration. Now, he doesn't have lupus. He doesn't have anybody in his family who's lupus, but he's very passionate to help with the cause. He's young. He's got a lot of energy. Also very opinionated. Okay. So I enjoy his company, but there's a level of agitation that he brings to me. All right. And one of them recently that is going on, and I'm trying to fix it, or I'm trying to understand where is everybody? Okay. What is everybody doing? Where are you? I sent an email out from my Suzanne at Lupus Greater Ohio to about 80 people in Columbus. Okay, where are you? How are you? We're trying to bring programs back to Columbus. What are you doing? I haven't heard from you in a while. We want to come back. Come visit me at the walk. I want to make a focus group. I want to bring you all back, find out what our needs are. Crickets. Not one person responded. Okay. Alex sent one out to a couple thousand. Okay. And out of the 1,000 emails he sent, maybe would you have 50 open them? If yeah. So emails, phone calls, Facebook. Where is everybody? Are programs that are on that we can do digitally, where we used to have like 150 people, or in person where we used to have 100 to 300 people, are down. So one, either they don't see the value of what we're doing, and I can't imagine that. I just can't imagine because we've come so long in the war against lupus. Or what is, I don't want them. I don't want them sitting home. I don't know. We're post COVID. And I think it changed the world. It changed the world. What is everybody doing? And God, I'm fearful that everybody's Googling everything. And although I love Mr. or Mrs. Google, that could be dangerous.
Yeah.
Okay. And better yet, it could need interpretation. So how do we pull everybody back in the new world that we're in today? Any suggestions? Because I think it's a mental thing.
Yeah,
Or
no, I
did they
know.
get lazy? They
I've
don't want to
definitely.
come out. Do they not feel safe? Alex said, "Well, maybe they don't have your needs anymore." I said, "Out of thousands of people, these aren't people that we put in our database. These are people through the years we serviced. Okay, where are they?" And we do patient navigator calls. All right, we are really blessed here in the state of Ohio. Alex and Adrian and a few dozen other people went to the state capitol and was able to get funding in the state capitol to do uh, patient navigation services. So we call anybody in our database who has lupus, we call them twice a year. Are you okay?
Mhm.
Do you have any barriers to care? We can help you. We can help you with food. We can help you with medicine. We can help you get to the doctor. And guess what? We can help you with mental health because we have joint partnerships with Signature Health. So that's my commercial I have here for Signature Health. Although we don't endorse products or services, what we do have this year is we have a resource with Signature Health. So if you're thinking about mental health, and you would like to have some counseling and you don't know where to start or the process, you can call Rita, all right, and Rita can direct you to any of those barriers to care. Because we don't, I want you, that this is a value to you, okay? If your insurance company doesn't pay for it, we're going to help you, all right? If you don't know how to do it through your insurance company, Signature Help's going to help you, okay? But we're going to help you. And I think even if you went for a few sessions, it's better than taking everything that you're holding inside and putting it on your spouse or your loved ones. Because here's what's happening. Yes, they want to support you, but they don't know what to do with your giving them. Okay? So now you're causing more harm, and that's not your intention. I've seen that happen over and over again. So I want you to see a value in the things we offer you, and I want you to start coming out of the cave.
Yeah,
Okay?
I don't.
Come
I'm
out.
chewing on that, and I don't. I definitely hear it in other areas too. People from AA tell me that the meetings are a fraction of
Flat.
what they used to
They're flat.
be.
Yeah.
Um, and I think some people are still COVID phobic. I know some
COVID
folks.
phobic. I haven't used that one. I'm going to steal it.
But some people are still, afraid to go to even grocery stores
Yeah.
and things like that. So that might be part of it. I think you're probably right about people are availing online resources and deciding that that's adequate information. We call it Dr. Google
Okay.
in our profession. But
I mean, I'm guilty. I'm
well, we all
guilty.
do it.
It's
We all do it.
horrifying. It's horrifying.
But you need a filter, like you said. There needs to be interpretation, and you can easily get read legitimate information and have it turn into disinformation because you're not understanding what you're reading, or you're connecting the dots in a way that aren't exactly right. And but I wish I had an answer to how to get people out of their caves. I really don't.
Yeah. It's unsettling to me. Okay. And guess what? I'm Italian. I need hugs. I I I came in last week and I said I told him I was hug deprived. The only hug I got was from him. As much as I welcomed it, it was like, where is everybody? Because we used to hug each other. All right. There's value in hearing Betty Boop's voice, all Sally Sue's voice, seeing them, touching them, whether they're tears or smiles.
We're social
Okay.
creatures. We're built that way.
Yeah.
Yeah. Even those of us that aren't
Well, I just don't know how to get them out of the cave, okay? And I want y'all to know that we are here for you, okay? And if you're going to be stuck in that cave for a while, you really need to weigh the benefits there. Are you really benefiting from being in the cave? Because I think it causes other issues. I think it can cause dementia. I think it can take you into another darker place than you want to be.
Yeah.
Okay. I think the brain was meant to be ignited, to be challenged, yeah, to be challenged. So if you're gonna sit, it's either okay or it's not okay. Either you're gonna come out or you're not gonna come out, and you suffer the consequences of either of those. But you're in charge. You're in charge. So when you go through a mental health program, so at Signature, I would imagine they would do an evaluation. Can you share? Is there steps? Step one, step two, step three, anything like that?
When somebody comes to the office, they meet with an assessment counselor who does a behavioral health evaluation and determines who they should see, what services need to be used,
Mm-hmm.
and then they would refer them to, in my case, psychiatry or counseling, or if substance use is an issue, to a substance use counselor or provider treatment. And then often referrals happen simultaneously.
Mm-hmm.
So a lot of times we are seeing people for medication management at the same time that they're getting in with a counselor or a case manager or whatever other needs they have.
And is it like an hour session, a half hour? Once they're evaluated and they actually sit with the counselor, is it an hour, a half hour? Is it weekly? Is it monthly? Or does it vary?
Yeah, there's really nothing written in stone. The classic counseling scenario is 50-minute appointments weekly for months and months, but that doesn't usually happen that way anymore. Um, Partly because of insurance companies telling us what we can and can't do, and partly because it isn't always necessary to have that intensive therapy. When I see people, again, for the psychiatry component, I will see someone for an hour the first time. Uh, Ideally, I'd like to see them back a couple of weeks later, but more often it's more like a month later. Usually we'll go once a month until things are at a point where we're essentially in maintenance. And when we're at maintenance, we go 60 or 90 days between appointments, or sometimes even longer than that if things have been really stable for a long period of time. And therapists do essentially the same sort of thing. It's more intense initially, and then dials back as it's appropriate and safe to do that.
Well, I keep thinking of myself, and I often talk to myself because I have the disease. Okay, and I'm sitting here, and my brain is peeling like an onion. I'm peeling back all these peels here, and I'm thinking the greatest thing I learned from therapy for so long, and I had it for so long, is that it helped me identify. Um, I don't want to say my weaknesses, my problems. Okay, and that so when issues come up, I can pull back. Okay, I can pull. I found a new me in the therapy, especially being an identical twin. So I don't know. A lot of people have heard my story, but I have an identical twin. We are mirror twins. We're 100% DNA matched. Okay, I'm the nice twin. Okay, and she'll tell you she's the mean twin. She will. She's got a mean streak about her. Um, but I think I had not only did I have lupus, I had an identity crisis. Okay. And as a young person, because I was sick so young in life, people would always, they couldn't remember our names. They knew we were twins. They knew we were the Valenti twins, but they couldn't filter which one was Janine, which one was Suzanne, because they both look alike. So they used to say to me, "Are you the sick twin?" Oh, dagger right to my heart. Dagger. Even today, when we bump into people, okay, they'll say, "Were you the sick twin?" It's like, oh. So we had damage to fix there. And of course, when I was diagnosed with lupus, they said I was going to die and it would be soon. Okay, they didn't know much about it. Okay, so you live with the fear factor. And when am I going to die? Is it tomorrow? Is it 2 days? Is it a year? What is it going to be? Okay, and then you go into this darker other place. And then I learned my own personal trait faults. And again, I'm going to blame it on being Italian. Okay, I hold grudges, and it's terrible. And it's like, how do you get rid of that? And why do I do it? Okay. So then I'm filtering this layer of this onion, pulling back. Because these are the things we learned that we unpacked in therapy. Okay. And that's where it's okay came into play. So at the end of the 3-year period is the glass half full or it's okay. You get to choose, and your attitude's important.
Hmm.
So I can tell you, I spent tens of $1,000s on therapy, and I can tell you, you don't need to do that today. All right, but also with therapy, they taught me pain, how to control my pain. All right, and as an example, I fell down the steps once and broke both legs. I was able to do guided geometry and walk to the car to drive myself to the emergency room. Okay, incredible amount of pain. All right. So you learn all kinds of things. All right. You peel back the layers of your life and episodes in your life that happen. And
And that's a really important thing about the benefit of long-term therapy. A lot of times people will come in during a crisis,
hmm
and the crisis settles down, and then they're done, they're good.
yeah.
But not really so much. And a lot of appointments, when I said we get to a maintenance phase, and we're at that point, we are doing preventative maintenance. We're looking at what could happen. What if this happens, then we'll do this, and
hmm
so that if someone, a lot of people will quit coming and then call back 6 weeks or 6 months later in a crisis
Can
again.
you get me back in
Um,
here? Yeah.
and my response, I think to myself, well, we would have talked about this if we met in person, for the
right.
last several months. And counseling is the same way for certain. And dealing with a crisis is important. It's definitely it's motivating to and necessary, and it's sort of Maslow's hierarchy of needs. You have to have the basic needs met before you can move up the pyramid to higher level things. But both parts of treatment have their relevance.
Yeah, and there's triggers too. I found that there's triggers of certain things. I mean, I could be moving around along perfectly, what I call my new normal, and then there'll be a trigger, and it's like, oh, it's like this is pain. You need to tell Alex, okay? You need to tell him to stop telling me I can't. Okay? When he says the word to me, I can't, I become like enraged. Okay? It's like
Is that a trigger for? Is that a little bit of
it,
a trigger?
it's a definite trigger, and I finally a couple of weeks ago I had to share with him that it's not acceptable to say you can't to me unless I've tried everything that I can do. Okay, within my power, can't is not an option, and it infuriates me. So I had to pull him aside and tell him, hey, buddy, this is not healthy for you and me because I saw red, and I said, Italians killed Rome, burnt Rome, but there's certain triggers that come along. And, I think sharing experiences, I try to get some of the girls in the back to come up and share life experiences, and not everybody's open for it, okay? I've spent the last, I don't know, 30 years, 3 decades trying to help people with lupus. And if I can help you have a better understanding, the conversation today is, and it's one of the better ones I've had with anyone in a long time that I feel really, really passionate about, is your brain is a very important part of your body, okay? And you don't know how to fix it. You're not, unless you have a PhD in psychiatry or medicine, um, and I don't think you're getting the push from physicians that you need to seek counseling. When you're told you have a chronic disease, okay, your whole life is going to change. It doesn't mean it's going to change for the worse. Okay. You may not be able to go to a sun tanning booth, which you shouldn't go to anyway. Okay. You may not be able to lay out in the sun for long periods of time. All right. You may not be able to do certain things. That's where the I can't. You can't. Okay. But what can you do? That was maybe on your radar, but everything was so full and packed with what you can do. Let's look at what's new. What did you want to do? Is there something else you can do? So let's look at those. Don't just lay there with the suitcase packed and said, this is gone or it's going away. Okay, let's pack a new suitcase. Okay, let's see what we can do new. And that's what really brought me to the Lupus Foundation. Okay, my background was jewelry. I was a gemologist. I was a jeweler. Okay, I was a realtor. My family owns a real estate company. Okay, and I can't do a lot of things. Every Christmas, I would get so sick from the stress. and everyone wanted me to wait on them. I couldn't. I couldn't. So I can't. I couldn't. So those are painful things for me, but I did learn that I can make a difference here at the foundation. Okay. I can't sit here. Okay. I can think of you. I can talk to you. I'm very educated about lupus. I know about advocacy. I know about programs. And I know that caring and sharing has great value. So you figure out what you can do in your new world. And that's where mental health comes in. I want you to really consider about where you're at mentally with this journey. Okay? Are you the best you can be right now, or can you get a little bit of help?
And again, I think it all comes down to connectedness. I think it comes down to the ability to get support and give support to other people, and that is important if you have lupus. It's important if you have depression. It's important if you have substance use disorders. Being connected with people who have similar conditions for the mutual support, and that's protective for depression too. But also, like you said, helping direct people toward treatment they need. And as we talked about before, they are very different things. The therapy treatment versus the self help treatment.
Yeah, they are. But I think one's a gateway to the other. Okay. Because there have been people in here where I've had to pull aside and say, you know what, you need you need to make a step up here, and I'm going to tell you why. Okay. And some people, even with me, get resistance, and then I can share. So it has a different value once you can share. Okay. But there's some people that, okay, support groups are going to be perfect for you. Education is going to be perfect for you. But you know what? You're in a different place. I feel strongly that maybe you should get some help here. Very strongly. So, I don't like being alone. All right. I had to up my Prozac. Okay. And I think it's because I'm disconnected from you. So, what did me getting lupus and getting involved in the foundation, and my whole family's involved in the foundation, okay, is giving me a purposeful life. What is your purposeful life? What are you doing? Okay. Because you can make a difference. You could have a lupus buddy. You can make a big impact. Okay. It's not what you get, it's what you give too. So we're at that time in society that we have to look out for each other because it's a crazy world out there. It's a crazy world. So, anything you want to throw out there at me? Because now you want to psychoanalyze me. You can tell I've had therapy, right?
Yes, I can, and you've done good work. That's it's very insightful, and I appreciate your perspective. And get help. I think if you need help, you should get it. And again, it's so easy to slip into depression without realizing that you have, especially with all the physical symptoms that happen for on the journey.
And if you let it go too long, it'll grab a hold of you. And you know, suicide is huge in this country. Right. Okay, it's just huge, and it can be fixed. Okay, not all of our problems in the world. Look, this isn't a band-aid either. It's just we're trying to give you another resource to have a better quality of life, and that's really what we do at the foundation.
I did have one thought since we talked about online resources and stuff. There was an article a couple of years ago. That made the rounds in the media about antidepressants not working. And I clicked on it because I was curious what that was about. And the full article was, don't work the way we think they do. Because Prozac, for example, is a serotonin reuptake inhibitor. And for a lot of years, a lot of doctors were telling people it acts like fake serotonin. It raises your serotonin level, which isn't actually true. It works through a complicated mechanism that has to do with serotonin, but it isn't fake serotonin. And so I think a lot of people may have seen that and decided, oh, it's a bunch of pharma-driven bunk. I'm not going to take an antidepressant because they don't work.
Right.
Again, that's something that in a public forum I want to call that out.
We've had in recent months we've had so much uptick on lupus research or findings or opinions on causes, cures, and the future for lupus. Okay, which is exciting. Okay, but we really got to be really careful where this is coming from. Who is the valid source? So I'm going to tell you right now, I served on the National Board of the Lupus Foundation, okay, in the past. And I was able to go to world conferences And I can tell you that other people looked to the United States for sound information. The Lupus Foundation of America is the leading source for the latest, most accurate information there is about lupus. You can go online and you can go in some of these side groups, and there's tons of them now, online groups. You need to be very careful where the data is coming from when it talks about cures for lupus or medications for lupus. We have people that go on our website, our Facebook page all the time and post that Dr. Sally Sue or something has this fruit juice. No, okay, let's stop there. Well, no matter what you do in the treating of your lupus, you have a conversation with your physician first. He is the best person for you because he knows what's going on. He's taken all the tests. He's had a physical observation. And if you don't like him, you have a conversation with him about that too. Okay? So here at the Lupus Foundation, I'm lonely. Okay? Alex isn't enough for me. All right. He says I can't too many times. I want you to come back out. I need you. You need me. Together there is no I in lupus, but there is the word us. The walks are coming up. If you need to, wear a mask. We're outside. We're going to be in Columbus. We're going to be in Cleveland. We have a summit coming up. Ask the Doc is coming up. It's where you actually get to ask a doc. We haven't done that in a while. We have a nurse on staff here with 20 patient navigators waiting to fill your needs. Or how about Suzanne? How are you? I'm really lonely without all you guys, all right? And as far as mental health and Signature Health goes, we won't have this for a long period of time here. So if you're thinking about maybe it's time to get an evaluation, call Rita. All right, she'll be happy to navigate that for you. And William, you've been a wonderful conversationist with me. Thanks for putting up with all my, because I could go on and on and on. All right, I'm not a young chick anymore. So my journey, what's interesting, at 27, they said I was going to die. So I'm 73. All right, so we've come a long way with lupus. There is hope on the horizon. All right, and here's the one thing for sure. We're not doing it alone. We're going to do it together. Thank you for coming. If you have any questions about mental health, you can reach out to Signature yourself. You can ask your doctor. Perhaps there's a resource that you'd like to use. But thank you all for coming to my Lupus Living Room, and I look forward to seeing you on the next podcast. Take care. Thank you. Remember, there is no I in lupus, but there is an us. Until next time, this has been my Lupus Living Room with the Lupus Foundation of America's Great Ohio Chapter. For more information and resources to help you in your lupus journey, please visit lupusgreatohio.org or call 1-888-NO-LUPUS. The funding for my Lupus Living Room is an earmark from the state of Ohio and managed by the Ohio Department of Health. Your physician is the best person to help you in the treatment of lupus. The information you learned here today can be discussed with your doctor, as your physician knows your medical history best. Please do not make any medical changes without consulting your physician first. As with any treatment, stay educated and get information from trusted sources.